The Alldus podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our ServiceNow series, where we interview the best and brightest of the industry to share their story, advice, and views on the exciting world of ServiceNow and digital transformation.
Hi everybody, it's Mark Kelly here. I hope you're doing really well today. In today's podcast, we've got John Bourbeau. John is VP of Support Services at Beth Israel Lahey Health, also known as BILH. And I'm going to give you a little bit of an overview about John for people that don't know him. John is a VP of IT Support Services at Beth Israel Lahey Health. He's a proven strategic thought leader with a focus on building customer-focused teams, delivering world-class support. A specialist with over 25 years of organizational transformation experience, John delivers impressive corporate IT support operations management, process improvement as a highly innovative, multi-skilled and outstanding problem solver and relationship builder. John, thank you very much for joining us on the podcast today.
Yep, thank you for having me, Mark.
John, for people that don't necessarily know about BILH, can you tell us a little bit of an overview about the hospital?
Sure. Beth Israel Lahey Health is an academic medical center and teaching hospitals specializing in various aspects of healthcare. We have more than 4,800 physicians and 40,000 employees across 13 different hospitals with a shared mission for access to care and advanced science and practice of medicine through a lot of groundbreaking research and education. One of the things that really intrigued me about joining here 18 months ago was the fact that it is, giving back. It is a service, right? It's healthcare, nonprofit, and where most of my career was in more in the business side, right? Tech sector, et cetera. This was really intriguing for me.
And when you look at your current roles and responsibilities, could you give us a little bit of an overview about them?
Sure, Mark. I oversee IT support at these 13 hospitals. I have 165 people across various support service lines. So IT is broken up into 11 different service lines. We have infrastructure, data analytics, our EHR applications. And as I said, I oversee support services, which consists of a 24/7, 365 multi-tiered service desk, field support, identity access management, ITSM, ServiceNow being our platform, device provisioning, mobility, and disaster recovery. So it's a lot of teams that's spread out, with my folks throughout the various hospitals.
When you look at that kind of complications, you probably, not complications, but I suppose so many different moving parts, you must pretty have a good understanding of the Now platform to really utilize and maximize it. How did you first get introduced to ServiceNow?
Sure. Earlier in my career, I would say, about 10, 11 years ago now, when I was a support manager at Smith & Nephew Medical Devices, we had a problem. And the problem was we had a very basic homegrown ITSM ticketing system. So I was charged with finding the next thing out there. And ServiceNow was really booming at the time, or starting to boom, I should say, right? And becoming a leader, not the leader. Remedy was the leader at the time. So I did an exhaustive assessment, and ServiceNow was the choice that I made at the time. And I haven't looked back. They've been a strategic partner in my career ever since. I implemented ServiceNow at McGraw-Hill Education when I went in there. It was already in place at Red Hat, but I was a big player as a consumer of the product, but helped it evolve and become my platform of choice in support and help implement ServiceNow across all the hospitals here.
When you look at digital transformation in your sector, area of specialization, healthcare is something that everybody has a foot in, right? Because we all want it to be successful because we're impacted by it day in, day out. Tell us a little bit about how some of the macro trends in digital transformation have been driven across your sector.
Sure, Mark. So one of the things about healthcare where it's different than a lot of other sectors is it's nonprofit, right? And you really have to watch funds. They're limited, right? And most of your funds are going to be going more to the clinicians in the clinical side. So your investments are minimal, and you have to really make smart choices. So one of the transformations that I've been focusing on, for my organization in my area, is the advancement of AI and automation. So how can I really scale my organization, right, by leveraging more of the technologies that's out there? Also, organizational transformation and building teams. How do you do that? How do you transform an organization to meet your customer demands, which are ever evolving? Having good metrics, right, to do that to reach operational excellence, how you can be cost efficient, and how you can get your ROI back on your investments, and also having that vision to create and drive the service roadmaps to align with the emerging technology and meet those customer demands. So I think those are four trends that really are up in front right now that you really need to focus on.
When you look at, you chose ServiceNow, you did an exhaustive research on it, and then you made that decision. When you're looking at, why is ServiceNow the platform of choice in healthcare? What do you think it does particularly well that others don't, that kind of allows you to continue to choose it and utilize it?
Yep. So I would say the power and flexibility that it offers, Mark. Being in healthcare and nonprofit, and I keep saying about, being cost efficient, right? Be able to scale. And it's so true, right? When you look at ServiceNow and the new products it's constantly releasing, how it's evolving the platform, how it's staying leading edge. It really has, and I know, like, I have other partners at other healthcare organizations in the Northeast and even Central US, and everyone is really evolving on ServiceNow, and it's become, the de facto choice.
And when you look at some of the examples of this, how it's benefited your business, would there be anything that for listeners listening in that they could get inspiration about?
Sure. So a lot of times, like when I came in here a year and a half ago, a lot of times I was kind of looking like, God, where should I focus on? My head was spinning, right? I had to take 13 hospital IT organizations and build them into one model, but fairly quickly. So looking at things, and kind of putting all the teams together from the different hospitals into one system, support channels was a big thing I had to look at, right? Everyone was calling the service desk. It was just call after call regarding it was a urgent issue or a very small issue. And when you're having average speeds of answer of 20, 30 minutes because everyone is calling, I had to look at new channels. So we implemented ServiceNow Chat, which has been a game changer, and recently introduced Virtual Agent to help deflect the need to reach a live person. And that has really been a game changer, as we've gotten our ASA and customer wait time down from an average of 20 minutes down to 2 minutes. We've implemented orchestration, right, for automation, repeatable tasks. So when you're onboarding employees, when you're doing the simple, repeatable task, we're freeing up our agents by automating all that work, using orchestration as our tool to do that. And that has been instrumental in our success.
When you think about 20 minutes down to 2 minutes, and then you also remind yourself that it's health. So we're talking critical need here to get that down.
Yes.
There's a lot of nodding heads thinking, I'm now doing impactful work, because people don't want to be waiting online. They want to be doing their work and kind of working through it. So, fantastic. That's great to hear. Absolutely great to hear. And a lovely example of how people can actually just better utilize their time and energy, and such a smart way to do that. When you also think about consistency, people want consistency. So you mentioned about the orchestration and onboarding. We found from our research is that if people aren't onboarded successfully in the first couple of days, there's a highly likelihood they're going to churn. And this could be where you and your colleague both start on the same day. However, you don't have your login details correct, and you're reading documentation while your colleague does, and they're in the Teams meeting doing high fives and getting going, and you're a day doing additional documentation because your laptop's late or you're not being processed correctly on the system. And that can have an impact on morale across the team. So that consistency of service makes a huge difference.
Especially here, Mark, in healthcare, right? So we'll have clinicians, we'll have doctors and nurses, and the access here is quite complicated because of the various EHR systems and the different modules within them. So a lot of times we'll have, if we don't onboard someone correctly, and it was happening quite a bit when I joined here, not anymore, I think, luckily, we would have doctors and nurses that couldn't treat patients, right? Because they didn't have access to the system. So it was affecting patient care. So, it's one thing you have someone in finance or HR or legal needs access and they can't do the job. And that's very intrusive and not a very good thing. But if it's even more so, if you have patients that can't be seen in a timely manner, right, it could be life-threatening because of the IT access that these clinicians require.
Yeah, nobody has patience for that. Absolutely. Tell us about some of the key learns from some of those projects and maybe advise the CIOs embarking on a transformation initiative, because there's a lot of people out there who are just kind of apprehensive to make that move.
Sure. I would say the right thing is finding a right partner, right? Because there are a lot of choices out there now with ServiceNow and with ITSM. So I would say having a partner that's aligned with your goals takes the time to understand your goals, what your objectives are, your timelines, and working within your budget, right? I'd say for me, that was a key part of our success, is having that right partner.
And when you're building and maintaining a winning ServiceNow team, what are some of the important milestones and advice you'd offer there?
A lot of times when people start up a new team, right, such as a ServiceNow ITSM team, you generally try to fill us with experienced people from the outside. But what's worked well for us here, Mark, is I've given a lot of folks, my team and I have given a lot of folks internally and given them a chance. We've invested them, support them, train them up. And then we also did hire some proven external talent too. But I think that mix, and then you have the proven external talent mentoring and growing your internal people. So that really gives the internal people, wow, this company has really invested in me. I'm in a booming technology now, and it's worked out. It's been highly successful for us.
And when you look at what's coming up next for the platform, what do you think the changes, or how will it evolve, maybe particularly within healthcare? Where do you see it going?
I want to continue to invest more in orchestration and AI, right? Those are key technologies that ServiceNow offers today, but I'm sure they're going to continue to enhance and grow. And then also we're interested in other modules such as ITAD, Discovery, Secure Ops. These are things that we're looking to make future investments in.
My last question is the question is kind of to help the people who listen to this podcast from the Rise Up program and who really want to get involved in the ServiceNow ecosystem. What advice would you offer to your younger self starting out?
I would say, Mark, be patient with yourself, right? Well, without taking your foot off the gas. So when I say be patient, set up a journey, set up your own roadmap, devise where you want your career to grow, set yourself goals and objectives, make them hard to reach, but not too difficult to reach, right? And then be your biggest supporter, fans, and at times critic, right? You want to hold yourself accountable, but if you make a mistake or you take the right turn, autocorrect, right? And get back on the path. And then, of course, value your people and treat them with respect and dignity. That's something I've held true my whole career. And you really need, without your people, you're nothing as a leader in an organization. And I find out that's very, very important.
Yeah, I like that advice. And also, by staying in your own lane and giving yourself, targets that are focused towards your goals and your ability level, you're competing with yourself, but you're also kind of holding yourself accountable, because you're saying, well, this is what I want to work towards. But if I don't hit it, at least I know the journey I'm on, and I can reassess that along the time as well. So it's great advice. John Bourbeau, VP of Support Services at Beth Israel Lahey Health. Thank you very much for your time today.
Thank you, Mark.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.